Fluorescent lights hum overhead. White tile reflects harsh glare. County General's emergency department smells like disinfectant and burnt coffee at 6 in the morning. A woman in scrubs moves down the hallway. Early 30s, dark hair pulled back tight. Her name tag reads Maya Reyes, RN. She's wiping down a gurney. Third time this shift. Her hands move efficiently, no wasted motion. Eyes scanning the corridor while she works. Not looking for approval. Looking for patterns. For what comes next, a resident breezes past, coffee in hand, barely glancing her way. Maya, gurney 4's a mess, and check the crash cart. Night shift left it half-stocked again. She doesn't argue, just nods. She finishes the gurney, pushes it against the wall, moves to the crash cart in bay 2, opens it, scans the contents in under 10 seconds. Missing, 2 epinephrine preloads, pediatric airway kit, backup IV start pack. She walks to a supply cabinet most staff don't know exists. Tucked behind a broken defibrillator nobody's gotten around to moving. She pulls what's needed, restocks the cart, closes it. Logs nothing. Nobody notices. 2 nurses pass the break room door. Maya's inside, eating a protein bar, staring at her phone. I don't get why she's still here, one says. Low voice. Not low enough. She's been at county for 2 years and hasn't even tried for charge nurse. Maybe she's comfortable where she is. Comfortable doing grunt work? I heard she worked in some clinic overseas before this. Probably got in over her head and came back. They laugh. Not cruel, just casual. Maya doesn't look up. Her jaw tightens slightly. She keeps chewing. An hour later, code alert overhead. Trauma incoming. ETA 2 minutes. MVA, multiple victims. The ER shifts into controlled chaos. Maya moves to bay 3. Preps IV lines. Lays out intubation kit, checks suction. Her hands know the rhythm. She's done this before. More times than anyone here knows. A senior attending, Dr. Patel, walks in, glances at her setup. Good instinct, Maya, but we won't need intubation for an MVA unless there's airway compromise. Let's not jump the gun. Maya pauses, looks at him. Copy. She leaves the kit exactly where it is. 3 minutes later, paramedics roll in a man. Mid-40s, chest trauma, labored breathing, oxygen saturation dropping fast. Steering wheel to the chest, suspected flail chest, possible pneumothorax. Dr. Patel moves in, listens, realizes. Get me intubation, now. Maya's already handing him the laryngoscope. He takes it without looking at her. Intubates. The patient stabilizes. After, he turns to a resident standing nearby. Good call prepping that kit. The resident blinks. I didn't. Dr. Patel's already walking away. Stay sharp. Maya watches him leave. No reaction. She strips her gloves. Moves to the next task. Later. Maya's locker between shifts. She opens it. Inside, spare scrubs, deodorant, protein bars, and, tucked into the corner, barely visible, a small faded patch. Fabric, worn edges. It reads, 68W, Combat Medic, 3rd Battalion, 75th Ranger Regiment. She doesn't touch it. Just looks at it for 3 seconds. Closes the locker, walks back into the ER. The day continues. Patients come, patients go. Maya moves through her tasks with the same quiet precision. Restocking, charting, starting IVs, holding pressure on wounds. A nurse calls her over. Maya, can you take this discharge paperwork to the patient in Bay 6? I'm swamped. Sure. She takes the clipboard, walks to Bay 6. An elderly man sitting on the bed, arm in a sling. You're all set, Mr. Brennan. Follow up with orthopedics in 1 week. Keep the sling on, else for swelling. He nods. Thank you, dear. She helps him down from the bed, steadies him as he finds his balance. He looks at her closely. You've got kind eyes, but sad ones. Maya pauses. I'm fine, just a long shift. If you say so. She walks him to the exit, returns to the nurse's station. Dr. Patel's there, reviewing charts. He looks up. Maya, administration wants to see you tomorrow morning. She stops. What for? The intubation set up earlier. You acted outside standard nursing protocol. They want to review it. Her face doesn't change. Understood. I'm not trying to get you in trouble. I just have to report it. I know. He watches her walk away. Something in her calm unsettles him. Later that night, Maya sits in her car in the parking lot, engine off, hands on the wheel. She closes her eyes, breathes in, holds, out. The hospital behind her is still lit, still loud, still full of people who need help. She thinks about the man she helped intubate today, about the ones she couldn't help years ago, about the line between those two moments. She opens her eyes, starts the car, drives home. Inside her apartment, she doesn't turn on the lights, just sits on the couch in the dark. On the table in front of her, a small notebook, battered, worn. She opens it. Inside, names, dates, places, Kandahar, Helmand, Jalalabad. She doesn't write anything new, just runs her thumb over the ink, closes it, puts it back, goes to bed. Tomorrow she'll do it again, show up, work, stay invisible. Because invisible is safe. Invisible means no questions. No questions means no memories. And no memories means she can keep moving forward, even if forward feels like standing still. Night shift, 2 a.m, the ER is quieter now. A few drunks in holding. One psych eval waiting on transport. The hum of machines, the flicker of monitors. Maya's refilling stock in the medication room, alone, counting vials, logging inventory. The fluorescent light above her flickers. She pauses. The flicker becomes a strobe effect, uneven, erratic. Her breathing slows. Her hand stops mid-reach. For a moment, she's somewhere else. Dust. Flickering emergency light inside a Humvee. Blood on her hands. Radio static crackling. A voice shouting her name. Not Maya, a different name. Reyes, stay with me. Reyes. Her own voice, younger, raw. I'm here. Keep pressure. Explosion. White light. Ringing silence. Maya blinks. The medication room light is steady again. Her hand is gripping the edge of the shelf, knuckles white. She releases slowly, breathes in, holds, out, finishes restocking, logs the inventory, leaves. 3:20 a.m. A man stumbles into the ER. Late 20s, construction vest, hand wrapped in a bloody rag. I cut it bad. He's drunk, slurring, swaying. Maya moves to him immediately, guides him to a chair. Let me see. She unwraps the rag, deep laceration across the palm, arterial bleed, not spurting, but steady, bright red. She applies direct pressure with gauze, firm, controlled. Page plastics, she says to the night clerk. Tell them possible tendon involvement, zone 2 flexor injury. The man winces. It's bad, right? It's bad. Maya doesn't look at him, just works. You're going to be fine. Keep your hand elevated, don't move. She preps a pressure dressing in under 30 seconds, wraps it perfectly, firm but not constricting, immobilizes the wrist with a splint. Dr. Liu walks over. Night shift. Shift attending. Sharp. Observant. What's the got? Deep palm laceration, likely flexor digitorum superficialis involvement, arterial bleeding controlled, plastics paged. Dr. Liu looks at the dressing, then at Maya. You do field medicine before this? Maya doesn't miss a beat. Something like that. Dr. Liu nods slowly. She doesn't push, but she remembers. 4 a.m. Maya sits in the break room, alone again. She pulls the small notebook from her pocket, opens it, runs her thumb over the names, the dates, the places she's tried to forget. She doesn't write, just looks, just remembers. Closes it, puts it back. Dr. Liu leans against the doorframe, watching. You always this good under pressure? Maya looks up. I just do the job. No, you do it like you've done it 1,000 times, in worse places. Silence. Maya holds her gaze. Night shift does that to you. Dr. Liu smiles faintly. Maybe, she walks away. But Maya knows, someone's starting to wonder. The shift ends at 7. Maya changes out of her scrubs, back into jeans and a plain shirt. In the locker room, she opens her locker. The patch is still there. 68W, Combat Medic, 3rd Battalion, 75th Ranger Regiment. She stares at it longer this time. Touches the fabric. Feels the worn stitching under her fingertips. A voice behind her. You served? Maya turns. It's a young paramedic, early 20s, eager face. She closes the locker quickly. A long time ago. Army? Yeah. My brother's deployed right now. Marines, Fallujah. Maya nods. He's lucky to have family waiting. The paramedic smiles. Thanks. Hey, If you ever want to talk about it, veteran to veteran, I know some people. I'm good, but thank you. The paramedic leaves. Maya exhales. That was close. She drives home, parks, sits in the car for 10 minutes before going inside. Her apartment is small, clean, minimal. No photos on the walls, no personal items visible. Just functional, like a place someone's passing through, not living in. She showers. The hot water runs over her. She closes her eyes, tries not to think. But the memories come anyway. They always do. A convoy, dust rising, the crack of gunfire, screaming, blood on her uniform, hands slipping. A young soldier, 19, maybe 20, looking up at her with eyes that said he knew he was dying. "Doc, am I gonna make it?" She lied. "Yeah, you're gonna make it." He didn't. Maya opens her eyes. Turns off the water, dries off, gets dressed. She makes coffee, sits at her kitchen table, stares at the wall. Her phone buzzes. A text from the hospital scheduler. "Can you pick up an extra shift tomorrow?" Short-staffed. She types back, "Yes," because staying busy is easier than staying still. And staying still means thinking. And thinking means remembering. And remembering means feeling everything she spent 3 years trying to bury. She drinks her coffee, goes to bed. Sleeps 4 hours. Wakes up. Does it again. This is her life now. Routine. Predictable. Safe. Until it isn't. The next evening, she's back in the ER. Same hallway. Same fluorescent lights. Same disinfectant smell. But something feels different. She can't name it. Just a tension in the air. A sense that something's coming. She shakes it off. Gets to work. A resident approaches her. "Maya, can you help me with a lumbar puncture in Bay 5? "Sure." She follows him. Preps the patient. Holds them steady while the resident inserts the needle. It takes 3 tries. Maya doesn't comment. Just keeps the patient calm. Afterward, the resident thanks her. "I don't know how. How you stay so calm. I was shaking the whole time." Maya strips off her gloves. "Practice. How long have you been a nurse?" 5 years total. 2 here. "You seem like you've been doing this forever." She almost smiles. Feels like it sometimes. The resident leaves. Maya cleans up, charts the procedure. Dr. Patel walks by, sees her, stops. "Maya, that meeting with administration, it's been moved to this afternoon, 4 o'clock. She nods. "Okay, they're not trying to punish you. They just need to understand your scope of practice." "I understand." He hesitates. "For what it's worth, you did the right thing yesterday." She looks at him. "Thank you." He walks away. Maya finishes charting, moves to the next task. But in the back of her mind, a clock is ticking. 4 o'clock. Questions, exposure. She spent 3 years staying invisible. That might be about to end. 5:47 in the morning. The ER is waking up. Day shift trickling in. Coffee brewing. Shift change chatter. The calm before the storm. Then, overhead PA. "Attention all staff. Mass casualty incident inbound. Repeat, MCI inbound. Industrial explosion. ETA 4 minutes. All available personnel to trauma." The room goes still for half a second, then erupts. Dr. Patel takes command. "Bay 1 through 4, clear them now. Get me crash carts, airway kits, 2 units O negative to each bay. Respiratory on standby." Nurses scatter. Maya moves toward Bay 3. Dr. Patel points at her. "Maya, supply run. We're going to need more IV start kits and gauze. Go." She stops, looks at him. "You'll need a second intubator if they're coming in hot. I've got residents for that. Go." She hesitates, then nods, turns, walks toward supply, but she doesn't go far. She stops in the hallway, listens, waits. The ambulances arrive, sirens wailing, doors bursting open, gurneys rolling fast. Male, early 20s, burns across chest and arms. Female, 50s, unconscious, ashen airway, possible smoke inhalation. O2 sat 81. Male, 40s, shrapnel wounds, bleeding from abdomen and leg. Maya moves back toward the trauma bay. Supply run forgotten. Dr. Patel is at the head of the woman, the unconscious one. Oxygen mask on her face. Monitor alarming. Get her on high-flow O2. Prepare for intubation. A resident moves in, fumbles with the laryngoscope. His hands shake. "I can't see the cords. There's too much debris." Suction. Suction first. The patient's oxygen saturation drops. 78. 74. Monitor alarm, steady, piercing. "I need to visualize. I can't." Dr. Patel leans in. "Move, let me." Maya walks into the bay. No supplies in her hands. She sees the situation immediately. Step back. The resident looks up, confused. Maya, not now. She's already at the head of the bed. Gloves on. She takes the laryngoscope from the resident's hand. Suction, now. A nurse hands it to her. Maya suctions the airway in 3 controlled sweeps. Fast, efficient. Doesn't obstruct her view. She speaks quietly, to herself. Cords at 11 o'clock. Swelling partial. Windows tight. She visualizes. Inserts the tube. Smooth, fast, 1 attempt. Tubes in. Inflate the cuff. The nurse does. Maya listens with a stethoscope. Both lungs. Bilateral breath sounds. She's secure. The monitor stabilizes. Oxygen saturation climbs. 81, 85, 91. The room exhales. Dr. Patel stares at her. Where did you learn to intubate like that? Maya pulls off her gloves. I've done it before. That wasn't nursing school technique. That was field medicine. She doesn't answer. Just moves to the next patient. The burn victim is screaming. 2nd-degree burns across his chest and arms. A nurse is trying to start an IV. Missing. Maya steps in. Let me. She finds a vein in under 5 seconds, inserts the catheter, flushes it, tapes it down. Start fluids, lactated ringers wide open. Get me a burn sheet and morphine, 5 milligrams IV. The nurse nods, moves fast. Maya covers the burns with a sterile sheet, administers the morphine. The man's screaming softens to groans. She stays with him, hand on his shoulder. You're okay. We've got you. Just breathe. He looks at her, eyes wide, terrified. Am I gonna die? No, you're not gonna die. Her voice is certain, absolute. He believes her. Across the bay, the 3rd patient, shrapnel wounds, is bleeding heavily from his abdomen. Dr. Patel moves to him. Get me pressure on that wound. Someone page surgery. A resident applies pressure. Blood soaks through the gauze immediately. It's not holding. More gauze. Pack it. Maya glances over, sees the blood, the angle of the wound, the patient's dropping pressure. She moves over. Let me see. The resident steps aside. Maya lifts the gauze, sees the wound. Deep, lateral, likely liver involvement. This needs direct packing, deep packing. Dr. Patel looks at her. We're waiting for surgery. He won't make it to surgery if we don't control this now. She doesn't wait for permission. She takes a stack of gauze, rolls it tight, inserts it directly into the wound cavity, packs it firm, applies pressure on top. Hold here. Firm pressure, don't let up. A nurse takes over. The bleeding slows, then stops. The patient's blood pressure stabilizes. 100/60. Holding. Dr. Patel watches her, silent. Maya steps back, strips her gloves. He's stable for transport. Surgery's ready? A nurse nods. They're on their way down. Maya walks out of the bay, back into the hallway, breathes. Her hands are steady, but her heart is pounding. Dr. Liu is standing nearby, watching. She walks over. That was impressive. Maya doesn't look at her. Just doing the job. No, that was more than the job. Silence. Dr. Liu steps closer, lowers her voice. You've done this before. Real trauma. Combat trauma. Maya finally looks at her. I need to finish my charting. She walks away. Dr. Liu watches her go, thoughtful. 2 hours later, the MCI is under control. Patient stabilized. Chaos settling into exhausted routine. Maya's in the hallway, charting on a tablet. Dr. Patel approaches. Maya, a word. She looks up. You saved that woman's life, no question. But I need to know, what's your background? Because that wasn't standard nursing. I trained overseas, different protocols. Overseas where? She doesn't answer. He softens. I'm not trying to interrogate you. I'm trying to understand who I'm working with. Before she can respond, a man walks into the ER. Mid-50s. Graying hair, weathered face, faded veteran's ball cap, jacket with a 75th Ranger Regiment patch on the shoulder. He's limping slightly, old injury, not urgent. He walks to the intake desk, and then he sees her. He stops, stares. Reyes? Maya's head snaps up. Her entire body goes rigid. A man steps closer, louder, certain now. Doc Reyes? The hallway goes quiet. Everyone within earshot turns. Maya's face drains of color. The man walks toward her, smiling, disbelieving. It is you. Holy shit. Doc Reyes? She finds her voice, low, controlled. You're mistaken. No, no way. He shakes his head. Helmand Province, 2012. Elf, Fob Jackson. You pulled me out of an MRAP after an IED flip. Punctured lung, fractured spine. You kept me breathing for 40 minutes until the bird arrived. He lifts his shirt slightly, shows a long surgical scar across his ribs. You signed my discharge papers. I still remember what you said. You're gonna hate rehab, but you're gonna live. Maya says nothing. Her jaw is locked. The man turns to the others, proud. This woman's a legend. 68 whiskey with 3rd Bat, 75th Rangers, 4 deployments. Saved more lives than half the surgeons I met. Silence. Heavy. Dr. Patel stares at Maya. Maya? She doesn't look at him. Maya's hands are trembling slightly. She hides them behind her back. The man is still smiling. Earnest. Grateful. He doesn't see the panic in her eyes. I never got to thank you properly, Doc. You gave me my life back. Maya's throat is tight. If he says more, if he keeps talking, they'll ask questions. Questions lead to curiosity. Curiosity leads to exposure. And exposure means they'll see her differently. Not as a nurse, as a soldier. And she didn't come here to be a soldier anymore. She forces the words out. I think you have me confused with someone else. The man's smile fades slightly. Confusion crosses his face. No, I don't forget a face. Especially not yours. You were the only medic who... I'm a civilian nurse, Maya cuts him off. Firm, you're misremembering. The man stares at her. Hope flickers in his eyes. But he's not angry, just bewildered. Doc? She turns away, walks toward the break room. Fast, not running, but close. The hallway is silent, everyone watching. Dr. Patel stands frozen. Dr. Liu crosses her arms. The veteran looks around, uncertain. Did I mess something up? Dr. Liu steps forward. Her voice is gentle. She told you she's not who you think she is. She's lying. Maybe she has a reason. The man nods slowly, processing. Yeah, maybe. But the damage is done. Whispers spread through the ER like wildfire. Did you hear that? Combat medic? 4 deployments? With the Rangers? That's impossible. She's just a nurse. Lee saw what she did with that intubation. That wasn't luck. Dr. Patel turns to Dr. Liu. His voice is low. I need to report what happened during the MCI. She performed an advanced procedure outside nursing scope. Dr. Liu meets his eyes. She saved that woman's life. I know, but protocol is protocol. You do what you have to do. But if you ask me, we need more people who act like her, not fewer. Dr. Patel exhales, nods, walks toward his office. In the break room, Maya sits on the couch, hands clasped, staring at the floor. Her chest is tight, her breathing shallow. She closes her eyes, tries to center herself. Breathe in, hold, out. But the walls are closing in, she can feel it. The carefully constructed distance she's maintained for 3 years is crumbling. The door opens. Dr. Liu steps inside, closes it behind her. You okay? Maya doesn't look up. I'm fine. That man seemed pretty certain. He's mistaken. Dr. Liu sits down across from her, quiet for a moment. Then, Maya, I'm not here to expose you. I'm here because I think you're carrying something heavy, and I think it's getting harder to carry alone. Maya finally looks up. Her eyes are tired. Guarded. I appreciate the concern, but I'm fine. You keep saying that. Because it's true. Dr. Liu leans forward. If you were a combat medic, and I'm not saying you were, but if you were, that's nothing to be ashamed of. That's something to be proud of. Maya's jaw tightens. I didn't come here to be proud. I came here to disappear. The words slip out before she can stop them. Dr. Liu doesn't react, just nods. And how's that working out? Maya doesn't answer. Dr. Liu stands. When you're ready to talk, I'm here. She leaves. Maya sits alone. The hum of the ER outside, the distant sound of monitors, voices, life continuing. She pulls out her phone, stares at the screen. No messages, no calls. She opens her contacts, scrolls to a name she hasn't called in 2 years. Colonel James Devoren. Her finger hovers over the name. She doesn't press it, just stares. Then she closes the phone, puts it away. Not yet. An hour later, Maya's back on the floor, charting, moving through tasks, trying to look normal. But staff are watching her differently now. Curious, wary, respectful. A young nurse approaches, hesitant. Maya, is it true? Were you really in the army? Maya doesn't look up from her tablet. I'd rather not talk about it. I'm sorry, I didn't mean to. It's fine. The nurse lingers, then walks away. Dr. Patel finds her near the nurse's station. Maya, that meeting with administration, it's been moved to this afternoon, 4 o'clock. They want to discuss the intubation and the wound packing you performed during the MCI. She nods. Understood. He hesitates, lowers his voice. They're also going to ask about your background. After what that veteran said, they'll want answers. I'll give them what I can. Maya, I'll handle it. He nods, walks away. Maya exhales slowly. The clock is ticking faster now. She finishes her charting, moves to restock supplies, keeps her head down, keeps moving. But she can feel the weight of eyes on her, the questions, the speculation. By noon, the entire ER knows. The story has spread, embellished, distorted. I heard she was special forces. No, she was a flight medic. Someone said she got a medal. Silver Star or something. Why would she hide that? Maybe she did something bad. Maybe that's why she left. Maya hears the whispers, ignores them, focuses on the work. A code blue is called. Room 10, cardiac arrest. Maya moves fast. Arrives first, an elderly man, unresponsive, no pulse. She starts compressions immediately, hard, fast, counting in her head. A resident runs in. I've got it. Keep bagging him, Maya says, doesn't stop compressions. Dr. Patel arrives, sees Maya in command. How long? 90 seconds, no shockable rhythm, continuing compressions. Epi? Administered 30 seconds ago. Dr. Patel watches her. The precision, the control, the absolute certainty in every movement. 2 minutes later, the monitor beeps. A rhythm returns, weak, but there. We've got him back, Maya says, steps back, breathes. Dr. Patel looks at her, really looks at her. You've done this a lot. She strips off her gloves. Yes, in combat. She meets his eyes, doesn't answer. He nods slowly. 4 o'clock. Don't be late. She watches him leave. The rest of the shift passes in a blur. Patients, procedures, charting. At 3:45, Maya changes into clean scrubs, washes her face, stares at herself in the mirror. She looks tired, older than 32. She thinks about the meeting, about what they'll ask, about how much she'll have to reveal. She thinks about the veteran, about the look in his eyes when she denied knowing him. She thinks about the men and women she served with, the ones who didn't come home, and she thinks about the ones who did, the ones who still carry the weight. She takes a breath, straightens her shoulders. 4 o'clock. She walks out of the locker room, down the hallway, toward the administrative offices. But before she reaches the door, the overhead PA crackles to life. Attention trauma, inbound GSW, officer down, repeat, officer down, ETA 90 seconds. The hallway erupts, staff running, voices shouting. Maya stops, turns, looks toward the trauma bay. Officer down means priority, means chaos. She forgets the meeting, moves toward the bay. Dr. Patel sees her. Maya, your meeting. Later. She's already moving, already preparing, already shifting into the mode she's tried so hard to leave behind. Because when someone's dying, protocol doesn't matter. Meetings don't matter. Only the work matters. The ambulance arrives. Paramedics burst through the doors. A man on a gurney, police officer, mid-30s. Gunshot wound to the upper chest, blood everywhere. Single GSW, right subclavian area. Suspected vascular injury. We've got pressure, but he's losing it fast. Systolic started at 110, now at 70. Dr. Patel moves in. Get me access. 2 large bore IVs. Start fluids wide open. Prep for chest tube. A nurse tries to get an IV in the officer's arm. Misses. The veins are collapsing. Try the other arm. The monitor alarm screams. Systolic 60. The officer's eyes roll back. He's crashing. Get me the chest tube now. Hands fumble. The tray clatters. Supplies scatter. The officer's pressure continues dropping. 50. 45. Where's vascular? 10 minutes out. He doesn't have 10 minutes. Maya stands in the hallway, watching. She sees it all. The hesitation, the fear, the seconds ticking away. She closes her eyes, breathes, opens them, walks into the bay. Stop. Everyone freezes. Dr. Patel looks up. Maya, your meeting. Move. Her voice isn't angry. It's command. Absolute authority. Dr. Patel hesitates. Their eyes lock. He sees something in her face he's never seen before. He steps aside. Maya moves to the head of the gurney, snaps on gloves. He's got a subclavian bleed. Chest tube won't fix this. He needs vascular control now, or he's dead in 2 minutes. Dr. Patel's voice is strained. Vascular's 10 minutes out. And we don't wait. She looks at the wound. High right chest, subclavian zone. bright red blood pulsing with each heartbeat. Scalpel, betadine, gauze packs, Foley catheter. A nurse stares at her. What are you? Now. The nurse hands her the supplies, hands shaking. Maya doesn't hesitate. She extends the wound with the scalpel. Controlled, precise. Blood wells up. She suctions, visualizes, inserts her gloved fingers into the chest cavity, finds the artery, feels the tear. I've got the bleeder. Foley catheter. A resident hands it to her. His face is pale. Maya threads the catheter into the artery, then inflates the balloon. Tamponade. Direct pressure from inside the vessel. The bleeding slows, then stops. He's stable. Get vascular here now to repair. Keep pressure on this balloon. Don't let it deflate. The room is silent. The monitor stabilizes. Systolic climbs. 65, 75, 85. Dr. Patel stares at her. Where the hell did you learn that? Maya strips off her gloves. Helmand, Kandahar, Jalalabad. Pick one. Before anyone can respond, the ER doors burst open. A man strides in. Late 50s. Graying buzz cut. Army uniform. Full dress. Colonel's insignia on his shoulder. Beside him, 2 military police officers. The entire ER goes silent. The colonel scans the room. His eyes land on Maya. He walks straight to her. Stops. Tops 3 feet away. Sergeant Reyes. Maya goes rigid. Her face drains of color. Sir, I need you to come with me. Dr. Patel steps forward. Excuse me, who are you? The colonel doesn't look at him. Colonel James Davarin, United States Army. And you are? Dr. Arjun Patel. I'm the attending physician here, and Maya is one of my nurses. She's in the middle of a shift. Not anymore. Dr. Patel's voice hardens. You can't just walk in here and take my staff. The colonel finally looks at him. His voice is calm, measured. Doctor, with respect, Sergeant Reyes isn't your staff. She's mine. He turns back to Maya. There's a situation. Overseas. High-value target extraction went sideways. The only medic they have in country is 19 years old and in over his head. They need someone with experience in hostile trauma. He pauses, steps closer, lowers his voice slightly. I'm not ordering you, Reyes. I can't. You're a civilian. But I'm asking you. 3 Rangers are bleeding out in a fire base in Syria. They're calling you by name. They know who you are, and they're asking for you. Silence. Heavy. Maya looks at the floor. Her hands are clenched at her sides. I'm out, sir. I've been out for 3 years. I know, and I wouldn't be here if we had another option. She looks at the officer on the gurney, stable now, because of her. Then back at the colonel. How long? 72 hours minimum. Could be longer depending on extraction windows and weather. Transport's waiting. She nods slowly. I need 10 minutes. You've got 5. The colonel turns to Dr. Patel. His voice carries through the bay, through the hallway. Everyone is listening now. For the record, Doctor, Sergeant Maya Reyes is a 4-time combat veteran. She deployed with the 75th Ranger Regiment as a 68 Whiskey combat medic. She has over 200 documented field saves, including a mass casualty event under fire that earned her a Bronze Star with Valor. He gestures to the officer on the gurney. What she just did? That's a Tuesday for her. He looks around the room, at all the staff watching in stunned silence. If any of you ever doubted her, don't. She's the best I've ever seen. He nods to Maya. 5 minutes, Sergeant. He walks out. The MPs follow. Maya stands in the middle of the trauma bay, every eye on her. No one speaks. She doesn't say anything, just walks toward the locker room. Dr. Patel watches her go, his face unreadable. Dr. Liu steps beside him. Quiet. You going to stop her? Could I? No. Dr. Patel exhales. She saved 2 lives today that I would have lost. I know. And I treated her like she was invisible. Dr. Liu nods. So did we all. In the locker room, Maya opens her locker, pulls out the patch. 68W, 3rd Battalion, 75th Ranger Regiment. She stares at it. Her hands aren't shaking anymore. The door opens. Dr. Liu steps in. You don't have to go. Maya doesn't turn around. Yes, I do. Why? Maya closes her eyes. Because they're calling my name. Dr. Liu walks closer. What happened over there? Why did you leave? Maya's quiet for a long moment. Then, I lost people. That's the job. Maya's voice sharpens. Not like this. She sits on the bench, hands on her knees. Helmand, 2013. We were overrun. 30 wounded in 6 hours. No air support. No reinforcements. Just me and a 19-year-old private who didn't even know how to start an IV. Her voice is steady, but her hands aren't. I triaged. I made the calls. Green, yellow, red, black. She looks at Dr. Liu. I tagged. Ged 7 men black. Expectant. Not enough resources. Not enough time. Dr. Liu's voice is soft. You saved the ones you could. I chose who lived. Silence. And you've been running from that ever since. Maya doesn't answer. Dr. Liu sits beside her. So why go back now? Maya picks up the patch, clips it to her jacket. Because those men over there didn't choose this. They're bleeding because someone sent them into hell. And if I can stop that bleeding, I have to. She stands, looks at Dr. Liu. I didn't leave because I stopped caring. I left because I cared too much. She walks to the door, stops, turns back. But caring too much is better than not caring at all. Dr. Liu nods. Come back, Maya. I will. Maya walks out, through the ER. Staff stop, watch her pass. The veteran from earlier is sitting in the waiting area. He stands as she approaches. Doc, she stops. Kick some ass over there. She nods. I will. She walks out the doors. The colonel is waiting beside a black SUV. Ready, Sergeant? She looks back at the hospital, then at him. Let's go. She climbs in. The door closes. The SUV drives away. 96 hours later. County General. Morning shift. The ER is tense. Word about Maya has spread beyond the department now. Residents whisper. Nurses share stories. Speculation fills the gaps. Dr. Patel stands in front of the staff. Residents, nurses, techs. His expression is serious. Before we start rounds, I want to talk about what happened this week. He pauses. The room is silent. Maya Reyes is one of the most skilled medical professionals I've ever worked with. And for 2 years, I treated her like she was invisible. He looks around the room, meets their eyes. I didn't listen to her. I didn't respect her instincts. And that's on me. Murmurs. Uncomfortable shifting. But it's also on all of us. We saw someone who didn't fit the mold, and we dismissed her. We let assumptions cloud our judgment. He picks up a tablet. Effective immediately, we're implementing a new protocol. Every team member, nurse, tech, resident, has equal voice in patient care decisions. If you see something, you say it, and we listen. Nods, agreement. Maya taught me that, and I won't forget it. Later that day, Dr. Liu runs a training session in the conference room. 20 staff members, simulation mannequins on tables. Field trauma techniques for civilian medicine. She demonstrates the subclavian balloon tamponade Maya performed. This isn't standard practice, but in a crisis, it saves lives. Maya proved that. Nurses take notes. Residents practice on the simulators, hands fumbling at first, then gaining confidence. Dr. Liu watches, corrects technique, encourages. The key is confidence. Hesitation kills. Precision saves. A resident looks up. How did she learn to do this so fast? Dr. Liu's voice is quiet. Because when you've done it under fire, you don't forget. A week passes. The nurse who mocked Maya in the break room, the one who said she was comfortable doing grunt work, approaches Dr. Patel near the nurse's station. She looks nervous, ashamed. Dr. Patel, I wanted to apologize. He looks up from his chart. For what? For what I said about Maya. I didn't know. I didn't understand. He nods slowly. Tell her, not me. I will, when she gets back. If she gets back. The nurse's face falls. You think she won't? Dr. Patel is quiet for a moment. I think she went back to a place she's been trying to escape for 3 years. And I don't know what that does to a person. 10 days after she left. 6 in the morning. The ER is just waking up. Coffee brewing, monitors beeping, the usual rhythm. The doors open. Maya walks in. She's in civilian clothes, jeans, plain jacket, a duffel bag over her shoulder. She looks tired, thinner, but whole. Dr. Patel sees her first. He's holding a coffee cup. He stops mid-step. Maya. She nods. Dr. Patel, welcome back. Thanks. He walks closer, lowers his voice. How'd it go? She's quiet for a moment. Then, They're alive, all three. He exhales. Relief washes over his face. Good. She looks around the ER. Anything change while I was gone? He smiles slightly. Everything. Later that afternoon, Maya's back in scrubs, but something's different. Her name tag has been updated. Maya Reyes, RN, trauma specialist. She's been assigned to lead a new program, civilian military medical integration, training ER staff in field trauma techniques. Her first session is at 3. She stands in front of 20 staff members, some familiar faces, some new. She's nervous. Her hands are clasped in front of her, but her voice is steady. My name is Maya Reyes. I'm a nurse. I'm also a former Army combat medic. She pauses, lets the words settle. For a long time, I thought those two things couldn't coexist. But I was wrong. She picks up a training mannequin, places it on the table. Today, I'm going to teach you how to stop a bleed in under 60 seconds. Because when it matters, 60 seconds is all you have. The staff leans in, focused, respectful. Maya demonstrates. Her hands move with precision, confidence. She explains each step, answers questions, corrects technique. At the end of the session, a young resident approaches her. Thank you, that was incredible. Maya nods. Just remember, speed matters, but accuracy matters more. The resident hesitates. Then, can I ask, what was it like, over there? Maya's expression doesn't change, but something flickers in her eyes. It was hard, but it taught me what I was capable of, and that's worth something. That evening, Maya sits in the break room, the same seat she sat in months ago, the same coffee machine humming in the corner. Dr. Liu sits across from her, 2 cups of coffee between them. You ever regret coming back? Maya thinks. No, you could have stayed overseas, gone back to the field full-time. I did go back, just in a different way. She looks through the window into the ER. Patients, staff, the controlled chaos. I used to think I left the battlefield behind, but the truth is, it followed me here. And that's okay. Dr. Liu tilts her head. Why? Because the fight's the same. Save the ones you can. Don't stop until you do. Dr. Liu smiles faintly. You sound like a soldier. I am a soldier, just a different kind now. Maya's phone buzzes. She looks at it. Unknown number. She answers. This is Reyes. A young voice. Male. Nervous. Sergeant Reyes, this is Specialist Corey Nixon. I'm a 68 Whiskey with the 82nd. I'm deploying in 2 weeks, and I heard about you, about what you did. Maya sits up. Go ahead, Specialist. I was wondering if you had any advice for someone who's scared they won't be good enough. Maya closes her eyes, breathes. You will be, because you care enough to ask. What if I freeze? You won't, because when it matters, your training takes over, and your heart does the rest. Silence on the line. Thank you, Sergeant. Come back safe, Specialist. She hangs up, looks at the phone, smiles faintly. Dr. Liu watches her. You're going to get a lot of those calls. I know. You okay with that? Maya nods. Yeah, I am. Later that night, Maya opens her locker. The patch is still there. 68W, 3rd Battalion, 75th Ranger Regiment. She picks it up, runs her thumb over the stitching. Then she pins it to the inside of her locker door. Not hidden anymore, just there. A part of who she was, a part of who she is. She closes the locker, walks back into the ER. A code blue is called. Room 12. Elderly woman. Cardiac arrest. Maya moves fast. Arrives first, starts compressions. Dr. Patel arrives seconds later, sees her in command. He doesn't take over, just watches. How long? 40 seconds. Asystole. Continuing compressions. Epi, administered, 1 milligram. 2 minutes later, the monitor beeps. A rhythm returns. Maya steps back, breathes. Dr. Patel looks at her. Your call. She nods. Get her to ICU. She's stable. The team moves, efficiently, confidently. Dr. Patel watches them, then looks at Maya. You've changed this place. She shakes her head. I just showed them what they were capable of. He smiles. That's exactly what I mean. Maya walks out of the room, down the hallway, past the nurse's station, past the waiting area. She stops at the doors, looks back, the ER at dawn, lights flickering on, voices murmuring, life continuing. And Maya Reyes, still there, still fighting, still saving lives. She turns, walks back in, because this is where she belongs. Not running from the past, not hiding from who she was, but integrating it, owning it, using it. The battlefield followed her home, and now she's made peace with that. Because the fight never really ends. It just changes shape, and she's ready for it. 6 months later, County General, evening shift. The ER has changed, not visibly, but the atmosphere is different, sharper, more cohesive. Maya leads a trauma team. Gunshot wound, severe abdominal bleeding. The patient is a young man, early 20s, gang violence. She works with absolute precision. Pressure here, large bore IV access bilaterally. T units O negative running wide open, prep for surgery. The team moves in sync. No hesitation, no wasted motion. A resident compresses the wound. A nurse secures the second IV. Another pages surgery. The patient's pressure stabilizes. 100/60. Holding. He's good. Get him to the OR. They roll him out. Fast but controlled. A young resident watches Maya. Awed. How do you stay so calm? Maya pulls off her gloves. Because panic doesn't save lives. Precision does. The resident nods, absorbing, learning. Later that night, Maya sits in the break room. Same spot, same coffee machine. But she's not alone anymore. Dr. Liu sits across from her. Dr. Patel enters, grabs coffee, joins them. They don't talk about cases, just sit, quiet, companionable. Dr. Patel breaks the silence. I got the numbers from administration since he started the training program. Our trauma survival rate is up 18%. Maya looks up. That's the team, not me. It's you, Dr. Liu says. You gave them confidence. You gave them skills they didn't have. Maya shakes her head. I just showed them what was already there. Dr. Patel smiles. You're too humble. I'm realistic. He leans back. You ever think about going back? To the military? Maya's quiet for a moment. No. Why not? Because I'm where I need to be. She looks through the window at the ER. Those men in Syria, I helped them. I'm glad I did. But this is my fight now. Right here. Dr. Liu nods. We're lucky to have you. Maya almost smiles. I'm lucky to be here. A month later, Maya's teaching another session. 40 staff members this time. Word has spread. Other hospitals are sending people to observe. She's demonstrating advanced airway management, a technique she learned in Kandahar. The key is visualization. If you can't see, you can't secure. But if you panic, you lose time. And time is what kills. She walks them through it, step by step, calm, clear. A visiting nurse from another hospital raises her hand. Have you ever lost a patient using this technique? Maya pauses, honest. Yes. The room goes quiet. But I've saved more than I've lost. And that's all you can ask for. The nurse nods, respectful. After the session, people linger, ask questions, thank her. One older nurse approaches. She's been at County for 20 years. I just wanted to say, you've changed the way I think about this job. I thought I knew everything, but you showed me I didn't. Maya's voice is gentle. You knew plenty. I just added a different perspective. The nurse smiles. Well, thank you. She walks away. Maya gathers her materials. Dr. Patel helps. You're good at this, he says. At what? Teaching, leading, inspiring. Maya shrugs. I'm just passing on what I learned. That's what good teachers do. 3 months later, the hospital hosts a ceremony. County General Emergency Medicine Excellence Awards. Maya's sitting in the audience, uncomfortable in a dress. She hates formal events. Dr. Patel is at the podium. This year, we're introducing a new award, the Reyes Award for Clinical Excellence and Innovation, named after someone who embodies both. Maya's stomach drops. She didn't know about this. This award will be given annually to a staff member who demonstrates exceptional skill, leadership, and commitment to patient care. He looks at her, and the first recipient is, of course, Maya Reyes. Applause. Loud, genuine. Maya stands. Reluctant. Walks to the stage. Dr. Patel hands her a plaque. She looks at it, reads the inscription. For those who lead by example, not by rank. She looks out at the audience. All the faces. Colleagues. Friends now. She speaks. Quiet at first. I don't know what to say. Pause. When I came here 3 years ago, I just wanted to disappear. I didn't want to be seen. I didn't want to be known. She looks at the plaque. But you saw me anyway, even when I tried to hide. And you gave me a reason to stop hiding. Her voice steadies. I've learned more from all of you than you've learned from me. You taught me that healing isn't just about skill. It's about community. It's about trust. She looks at Dr. Patel, at Dr. Liu. Thank you for seeing me. Not as a soldier, not as a medic, but as a person. Applause again, longer this time. Maya steps down, returns to her seat. Dr. Liu leans over. That was beautiful. Maya shakes her head. I hate public speaking. You're good at it. I'm really not. They both smile. Weeks pass. The rhythm of the ER continues. Codes, traumas, saves, losses. Maya's integrated now, fully. No longer the outsider. No longer invisible. She's part of the team. A leader. A mentor. One evening, she's charting when a young nurse approaches. The same one who gossiped about her 3 years ago. The nurse hesitates, then speaks. Maya, I owe you an apology. Maya looks up. For what? For what I said before. About you being comfortable doing grunt work. I didn't understand. I judged you. Maya's expression softens. It's okay. It's not. You're one of the best people I've ever worked with. And I almost missed that because I was ignorant. Maya puts down her tablet. We all make assumptions. What matters is what we do after. The nurse nods, emotional. Thank you. She walks away. Maya watches her go. Thinks about how far they've all come. Later that night, Maya's at home. Small apartment. Still minimal, but warmer now. A few photos on the wall. Her and the ER team at a holiday party. Her and Dr. Liu hiking. She sits on the couch, opens her notebook, the one with names and dates. She hasn't opened it in months. She looks at the names, runs her finger over them, remembering. Then she picks up a pen, writes something new at the bottom. They're still with me, but I'm moving forward. She closes the notebook, puts it on the shelf. Not hidden, just westing. Her phone rings. Unknown number again. She answers. This is Reyes. A voice, female, young, shaking. Sergeant Reyes, my name is Private Alicia Santos. I'm a combat medic. I just got back from deployment and I can't stop seeing their faces. The ones I couldn't save. Maya closes her eyes. She knows this voice. She's been this voice. Where are you right now, Private? At home, alone. Are you safe? Yeah, I don't know what to do. Maya's voice is steady, calm. You're going to breathe with me. In for 4, hold for 4, out for 4. She guides her through it, over and over, until the shaking voice steadies. You did your job, Private. You did everything you could. And the ones you saved, they're alive because of you. But the ones I didn't, they're not your fault. War is the fault, not you. Silence. I don't know if I can keep doing this. Maya's voice is firm. You can, because you're still here, and that means you have more to give. Another silence. Thank you, Sergeant. Call me anytime, Private. I mean it. She hangs up, sits in the quiet. Dr. Liu's words echo in her mind. You're going to get a lot of those calls. She was right. But Maya's ready, because she knows what it's like to carry that weight alone. And she knows how much it helps to hear someone say, "You're not alone anymore." She stands, looks out the window, the city lights, the hospital in the distance. Tomorrow she'll go back, teach, lead, save, because that's who she is now. Not running, not hiding, just living, fully, honestly. A soldier, a nurse, a teacher, a survivor, all of it, at once. And finally, that feels like enough 12 years later. County General, early morning. The ER is alive with motion, voices, alarms, the rhythm of controlled urgency. Maya walks through the hallway, older now, mid-40s, gray threading through her dark hair, lines around her eyes, but her movements are still precise, still confident. Her name tag reads, Maya Reyes, RN, MSN, Director of Trauma Services. She's reviewing charts on a tablet when a young resident approaches, novice, eager. Dr. Reyes. She looks up, corrects gently. Still just Maya. I'm not a doctor. Right, sorry. Maya, there's a multi-vehicle accident inbound. 5 victims. Command wants you in Trauma 1. She nods. On my way. The resident follows her. I've read all your case studies. The subclavian tamponade protocol is required reading now in our program. Maya glances at him. Don't believe everything you read. I just did what needed doing. That's what everyone says about you. She almost smiles. Then everyone's being too kind. They enter Trauma 1. The team is already assembling. Nurses, residents, respiratory. Everyone moving with practiced efficiency. Maya takes position at the shed of the first bay, calm, centered. First victim ETA 90 seconds. Let's be ready. The doors burst open. Paramedics rush in. A woman, 30s, unconscious, multiple injuries. Ejected from vehicle, GCS 6, hypotensive, suspected internal bleeding. Maya moves immediately. 2 large bore IVs. Activate massive transfusion protocol. Get me a fast exam and portable chest x-ray. The team responds instantly. No hesitation, no confusion. A younger nurse, barely out of school, fumbles with the IV kit. Her hands shake. Maya steps beside her, voice low, steady. Breathe. You've done this 100 times in simulation. This is just one more. The nurse nods, tries again, gets it. Good. Now tape it down, secure it. The nurse does. Maya squeezes her shoulder briefly, moves on. The next 3 patients arrive in quick succession. Maya orchestrates, delegates, supports. 1 patient crashes, cardiac arrest. She takes over compressions without a word. Hard, fast, counting silently. 2 minutes later, they get him back. Good work, everyone. Keep him stable. Let's get him to surgery. After the chaos settles, Maya steps into the hallway, leans against the wall, breathes. Dr. Patel, now chief of emergency medicine, walks over. Older, too. Graying beard, but the same sharp eyes. You made it look easy. Maya shakes her head. It wasn't. It never is, but you still make it look that way. She looks at him. We lost 1. We saved 4. I know. He's quiet for a moment. You can't save them all, Maya. I know that too. Doesn't make it easier. He nods. No, it doesn't. Later that afternoon, Maya's in her office, small, functional. Walls covered with commendations, photos, certificates. 1 frame stands out, a group photo, her old ranger unit. Dusty uniforms, tired faces. She's in the center, younger, smiling slightly. She looks at it sometimes, not with pain anymore. Just remembrance. Her phone rings. She answers, Reyes. A voice, male, official. Ms. Reyes, this is Lieutenant Colonel Marcus Chen, Walter Reed Medical Center. I'm calling because we're developing a new combat medic training curriculum. Your name came up repeatedly as someone we should consult. Maya leans back. I've been out of the field for 15 years, Colonel. I'm aware. But your techniques are still being taught. Your protocols have saved lives in 3 separate theaters. We want your input on how to train the next generation. She's quiet. Will you consider it? Send me the details. I'll review them. Thank you, Miss Reyes. She hangs up, stares at the phone. Dr. Liu knocks on the doorframe, steps in. Big decision? Maya looks up. Someone wants me to help train combat medics. You should do it. I'm not sure I'm the right person anymore. Dr. Liu sits. You're exactly the right person. You've lived both sides. You know what it takes to survive out there and to come home and keep going. Maya's quiet. What are you afraid of? Going back. Even just mentally. You've already gone back. You went back when that colonel came for you. And you came home. Maya nods slowly. Yeah, I did. So do it again, but this time on your terms. Maya smiles faintly. When'd you get so wise? I learned from the best. Months later, Maya stands in front of a classroom at Fort Benning. 60 combat medic trainees, young faces, eager, nervous. She's in civilian clothes, no uniform, but her presence commands the room. My name is Maya Reyes. I'm a former 68 Whiskey with the 75th Ranger Regiment. 4 deployments, and I'm here. Here to tell you what they won't teach you in the manual. She pauses. You're going to see things that will stay with you forever. You're going to make decisions that feel impossible. And you're going to lose people. The room is silent. But you're also going to save people. And those saves will matter more than you can imagine right now. She walks between the rows. The most important thing I can teach you is this. Your skill will save lives, but your humanity will save you. A young soldier raises his hand. What if we freeze? Maya stops, looks at him. You won't, because your training will take over, and because the person next to you is counting on you. Another hand. Female soldier. How do you deal with the ones you can't save? Maya's voice softens. You remember them, you honor them, and you keep going, because the next person who needs you deserves everything you have to give. She finishes the session. Soldiers approach afterward. Questions, thanks, stories. One young medic, barely 20, lingers. Man, I'm scared I won't be good enough. Maya looks at her, really looks. Being scared means you care, and caring means you'll fight harder than anyone who isn't. The medic nods, eyes bright. Thank you. Maya watches her walk away, sees herself 15 years ago. Evening. Maya's back at County General. She doesn't work full-time in the ER anymore, but she still picks up shifts. Tonight, she's in trauma too. Elderly woman, cardiac arrest. Maya starts compressions. The team works around her, smooth, coordinated. 3 minutes later, they get her back. Maya steps away. A younger nurse takes over post-resuscitation care. The nurse looks at Maya. How many times have you done that? Maya thinks. I stopped counting years ago. Do you ever get used to it? No, and I hope I never do. Later, Maya's sitting in the break room, alone, coffee in hand. She pulls out her phone, opens her contacts, scrolls to a name, Private Alicia Santos. She texts, checking in, how are you doing? A response comes quickly. Good, really good. Started nursing school, thanks to you. Maya smiles, types back, proud of you. She puts the phone away, looks around the break room. The same walls, the same coffee machine, the same hum of life outside. But everything's different now. She's not hiding anymore, not running, not trying to be invisible. She's fully present, fully herself. A nurse pops her head in. Maya, MVA inbound, they're asking for you. She stands. On my way. She walks out, down the hallway, into the trauma bay. The doors open. Paramedics rush in. Maya moves into position. Talk to me. Male, 60s, head-on collision, decreased LOC. She's already working. Hands moving, mind focused, heart steady. This is who she is, who she's always been. A healer, a teacher, a soldier in a different uniform. The work continues. The saves, the losses, the moments that matter. And Maya Reyes, nurse, medic, mentor, survivor, is exactly where she's supposed to be. Not looking back, not running forward, just here, present, whole. The ER doors close behind her. Inside, the lights glow. Monitors beep. Voices call out. Life continues. And so does she. Still fighting. Still saving. Still caring. Because that's what she does. That's who she is. And she wouldn't have it any other way. The camera pulls back slowly. Through the window. Into the night. The hospital stands lit against the darkness. Inside, Maya works. The team moves around her. Patients arrive. Patients leave. The rhythm never stops. And neither does she. Fade to black.